The United States is home to over 300 million people and over 200 million personal and commercial vehicles. Urban areas of the United States account for nearly 80% of the U.S. population and are expected to grow in the coming years. While urban areas often include some form of public transportation, many U.S. cities are still heavily reliant on motor vehicles. Some of the pollution that impacts our air quality are a result of multiple sources of pollution, such as dust, wildfires, factories, power plants, equipment, and transportation-related sources. Transportation-related sources are one of the largest contributors to poor air quality in the U.S. and globally. This includes cars, diesel vehicles, and airplanes. They lead to transportation-related air pollution, which can contribute to smog, soot, and overall poor air quality. Particulate matter, sometimes called particulate pollution, are mixtures of chemicals such as sulfates, nitrates, carbon, or mineral dust that contribute to air pollution. 3 common particles are PM10, PM2.5, and ultrafine particles, which are smaller than a strand of human hair. These particles are inhalable and easily pass from the lungs into the bloodstream, contributing to poor air quality and causing devastating health impacts, as well as premature death. In 2016, a study conducted by multiple universities found that ozone and fine particulate matter from vehicle emissions led to an estimated 7,100 deaths in the Northeast and Mid-Atlantic regions of the U.S. While chronic exposure to air pollution is associated with premature death, it is also related to other health conditions. Some health conditions you may be familiar with are asthma and chronic obstructive pulmonary disease, also known as COPD, which can lead to decreased lung function. Other health impacts might surprise you, such as stroke, heart disease, cancer, and premature birth. There are 5 main factors that contribute to someone's health being impacted by transportation-related air pollution. The first factor is exposure, referring to where people live, work, and attend school, which puts them at a higher risk level of being exposed to air pollution. The second factor is susceptibility. Air pollution can aggravate existing health conditions, including pre-existing respiratory or cardiovascular issues. The third factor is related to structural factors. Social, economic, and political structures in the United States have created and maintained inequities. As a result, low-income communities, communities of color, people who are incarcerated, people with disabilities, and other marginalized groups are more likely to be overburdened by air pollution. The fourth factor is access to health care. A lack of access to linguistically or culturally responsive health care can lead to people not having access to crucial health-related information about how environmental stressors such as air pollution can affect their health. The fifth factor is psychosocial stress. Research has found that non-physical stressors such as poverty, migration status, and racial ethnic discrimination can amplify the effects of air pollution. While poor air quality affects us all, the health burden is not shared evenly by everyone. This understanding is crucial to how we identify solutions to reduce transportation-related air pollution and people's exposure to it. While the health impacts are concerning, thankfully, U.S. policymakers and organizers are working to improve the health and well-being of people. At the state level, states such as California and Massachusetts are creating action plans and funding mechanisms. California is trying to tackle freight-related transportation, such as trucks, shipping containers, trains, emissions, through the California Sustainable Freight Action Plan, which sets a goal of using zero or near-zero emissions equipment to transport freight. California is also trying to use advanced vehicle technologies and updated vehicle standards to scale down emissions of passenger cars, pickup trucks, and SUVs. And Massachusetts is administering grants to invest in the development of cleaner technologies to increase hybrid and electric vehicles on the road. At the city level, cities such as Oakland, California, are using air quality data to inform public transportation planning efforts, And New York City introduced congestion pricing, which is when a driver of a truck, vehicle, motorbike, rideshare, and taxi are charged a fee for driving in Manhattan's central business district during the day. Congestion pricing comes with critiques, but there are also benefits such as reducing traffic congestion, greenhouse gas emissions, and the use of the revenue to fund public transportation. Aside from policymakers, groups across the country have been working to build resident power around pressing environmental and climate issues such as air pollution. These groups provide community education, community spaces, champion community-based solutions, and help make environmental health data more accessible. In East Boston, a neighborhood of Boston, Massachusetts, 2 groups are fighting to improve air quality for this historically working-class immigrant neighborhood. Mothers Out Front, East Boston, a local chapter of the national organizing group Mothers Out Front, have been organizing mothers and allies in the community to take action for climate justice, including advocating for systematic changes at the local and state levels and engaging community members about the impact of air pollution. They've also been distributing air purifiers to home daycares, as well as organizing against the Logan Airport in Boston, a major polluter in this environmental justice community. Another East Boston organization fighting for change is Airport Impact Relief Incorporated, also known as Air Inc. Air Inc. is a volunteer community group which works to reduce airport impacts and improve quality of life in East Boston. A large part of the work focuses on advocacy efforts that engage multiple stakeholders and community education efforts focused on educating residents about the impact transportation-related air pollution has on the environment and people's health. While politicians and organizers work to reduce transportation-related air pollution and our exposure to it, there are things that you can do to reduce your exposure. Your phone's weather app, along with websites like Air Now, can provide you information about air quality for the day. The Air Quality Index, a color-coded system for reporting air quality, can help inform when and how much time you should spend outdoors based on the air quality for the day. Air quality ratings coded as moderate and above pose a risk for people sensitive to air pollution, including people with heart or lung disease, older adults, children and teenagers, pregnant people, and outdoor workers. When air quality ratings are coded as unhealthy to hazardous, they are unsafe for all people. You can use the Air Quality Index as a guide to reduce your exposure to air pollution, such as trying to avoid regular physical activity, such as jogging outside when the air quality is coded as unhealthy to hazardous, trying to avoid regular long-term activities near high-traffic roadways, wearing N95 respirators or masks when there is poor air quality, and using indoor air purifiers or upgrading of air filters in our central heating, ventilation, and air conditioning systems. More can be done to reduce human exposure to transportation-related air pollution and the adverse health impacts. Additional strategies include retrofitting existing diesel vehicles with current pollution control measures to reduce emissions, getting involved in local community organizing efforts, promoting transportation choices such as public transportation, biking, and other innovative transportation measures that reduce emissions, seeking solutions to reduce pollution generated by airports, high-volume roads and railroads, and ports, and improving air filtration in schools, public spaces, and homes. To learn more, visit www.envisioningcleanair.com.